Hey guys, Conspiratard here. I came across something very interesting in an old issue of the Journal of the American Dental Association and the Dental Cosmos. This is from February 1937. So in it, hold on, let me find the page. 308, 307. In it, there is an article, Toxic Potentialities of a Fluoride Dentifrice. A dentifrice is a toothpaste, basically. So, in an earlier report, the Council called attention to the granting of patents for dental articles after what appeared to the Council to be inadequate scientific study. More recently, a patent has been issued by the U.S. Patent Office for a dentifrice which is stated to contain, as one of the important ingredients, sodium fluoride. Claims that it will whiten teeth by virtue of the fluoride content are permitted. These allowed claims were investigated at the request of the Council by a qualified collaborator in the laboratory of a member of the Council because 1. A patent for an essentially toxic substance in a dentifrice was issued, and 2. It was believed that the attention of the profession should be called to the presence of a potentially toxic substance which appear in dentifrices from time to time. Anyway, I am going to skip the technical details of all this and go right to the comments and conclusions. Comments: in spite of the failure to produce bleaching of rat incisors with reasonable amounts of the poisoned tooth powder in the diet, the inclusion of sodium fluoride in the formula is irrational and should be discouraged. The claims that sodium fluoride in the preparation bleaches the teeth is based on false premises. Bleaching of human teeth by fluoride occurs only in children prior to the eruption of the permanent teeth. The mechanism depends on an internal physiological action. No effect is produced on the enamel of permanent teeth subsequent to eruption. Ammonium fluoride is used in dental practice to whiten teeth, but this action on external application to the teeth depends on an etching effect of the ammonium fluoride, which is acid in reaction. Such an action would not occur with sodium fluoride added to toothpaste, which is alkaline in reaction, as shown by the investigation of Sharples and McCollum. Fluorine is not an essential element in tooth structure, and even if it were essential, it could not be supplied by rubbing on the tooth surface. A rational scientific basis for the use of sodium fluoride in toothpaste does not exist. And then it's despite the fact that the results as to toxicity of this commercial product were essentially negative, it does not follow that the product is necessarily innocuous or at least free from toxic potentialities under all possible dental conditions. For example, local absorption of the fluoride might be promoted by massage of the gums with the aid of a toothbrush, and by the presence of pathological conditions such as ulcers, inflammatory states, pus pockets, and the like. In other words, uncontrolled usage of the product by the laity might still result in undesirable systemic reactions, especially in children. So the conclusions are this. 1. The fact that a patented fluoride dentifrice was not demonstrably toxic when tested for typical fluoride toxicity in feeding experiments on rats does not mean that this dentifrice is not potentially toxic under all dental conditions. And 2, conditions of dental usage and pathological states in the mouth might promote absorption of fluoride and toxicity. And 3, the final conclusion, the use of fluoride in dentifrices is unscientific and irrational and therefore should not be permitted. Mic drop. I'm out.